At La Jolla's Sanford Burnham Institute, more than 500 people are involved in cancer research. Dr. Sarah Courtnedge directs one of the labs. For more than 7 years, Courtnedge has been studying how cancer cells invade tissues.
Both in the primary tumor that people get, but also in the spread of the cancer around the body, which is the thing that most people will die of, is the metastases that they have. And so we're very interested in defining the mechanisms by which cancer cells move and invade, and then also thinking about ways that we could come up with new therapeutics that would target that specific mechanism.
Courtnedge points out it takes years of false starts and multiple clinical trials to get even one potential cancer drug to market. And that requires a lot of money. Courtnedge and other cancer researchers' main source of funds is the federal government. But she says federal grants are becoming much tougher to get than they used to be.
We have a lot of ideas, and particularly in California, there are some terrific cancer researchers who are being limited right now in terms of what they can do. It's not their imagination that's limited, but it's the resources for them to be able to bring this forward.
Prop 29 on the June ballot would be a windfall for cancer research. It would raise California's tobacco tax by $1 a pack. Some of the money would go to smoking prevention. Most of it would go for cancer research. The American Lung Association is one of Prop 29's major backers. The association's Deborah Kelly says California used to have one of the highest tobacco tax rates in the country. But since California last raised tobacco taxes in 1998, a lot of other states have passed us by.
Well, we are standing at a pathetic 33rd. That means 32 other states have higher tobacco taxes than we do.
Kelly says under Prop 29, the tax on a pack of cigarettes would jump from 87 cents to $1.87.
The only people in California who are going to pay this tax are the 12% who continue to smoke, continue to buy tobacco products. And so what's going to happen is they're going to be more motivated to quit smoking, or they're going to smoke less. Fewer kids are going to start smoking, and so altogether this is going to mean a huge decrease in the number of people who smoke.
And that has tobacco companies up in arms. They've bankrolled a massive ad campaign against Prop 29.
I'm against smoking, so I thought Prop 29 was a good idea. Then I read it. It raises $735 million in tobacco taxes, but not one penny goes to new funding for cancer treatment. Instead, it creates a huge new research bureaucracy with no accountability.
It imposes nearly $1 billion in new taxes on Californians, but doesn't require it be spent in California creating jobs.
As of mid-May, tobacco giants have committed nearly $40 million to defeat Prop 29. That's nearly 4 times as much money as backers have raised. But supporters of the measure remain undeterred. San Diego allergist Michael Welch admits that California smokers already pay more than $5 a pack.
It's an expensive little pastime to smoke, but apparently it isn't a deterrent enough. And there's data to show that for about a 10% increase in the cost of a pack of cigarettes, about 4 to 5% of people will either not take up the habit or stop the habit if they have the habit. And those numbers sound good.
And the possibility of getting more money for cancer research sounds good to San Diego's scientific community, especially Dr. Christina Vori.
Biotechnology, medical research is one of the drivers for the economy in San Diego and in many parts of the state in general, and I think it will be very helpful to spark the economy at these times when things are not as rosy as they were some time ago.